Hi everyone, my name is Madeline Luck. I decided to do my presentation over with a nurse. I decided to interview her. So just a little background information about me. I have wanted to be a nurse since I was in freshman year of high school, so about 5 years. My personality type, when we did the personality test, nursing was actually a profession listed for my personality, so I really feel like this will be a career that I can excel in. So the nurse I interviewed, her name is Stephanie Hubbard. She is an RN and has her BSN. She works as an oncology nurse at Swedish First Hill. Nursing is in really high demand, especially with the aging baby boomer population. She's been a nurse for 5 years. Why did she go into nursing? So Stephanie became a nurse when she was 35 years old. She used to own a bar in Seattle and decided that that wasn't fulfilling her career needs or wants. So she decided to become a nurse, and she has never wanted to look back. So Stephanie's everyday daily life starts by her making rounds on patients. She takes vitals every couple of hours, depending on the patient. She gives medicine every couple of hours, depending on the patient, and she helps advocate for patients' health and best interests. She said that due to Seattle's growing diversity, it's sometimes difficult to listen to families versus patients' needs, because families will be very in touch with their culture still, and the patients will not be. So she said that's really difficult, but she makes it work. So how does one become a nurse? So typically, people get their bachelor's degree in the science of nursing. And after you do that, to become a registered nurse, you have to take the NCLEX exam, which is a nationwide exam to become a registered nurse. Before she started working on the oncology force, she had to have 6 months of experience elsewhere due to the floor is very high in demand, so they have to have nurses that are really skilled. She also had to become chemotherapy certified to be able to handle and administer chemotherapy drugs. She had to do a typical new nurse training at Swedish. They do this typically when you're first hired by Swedish to make sure you know what is expected of you, where everything is, and how they treat their patients. She said some advice that she would give to someone going into this career is that nursing is not just medical, but also social. She said she struggled with that for a little bit, like trying to understand what that meant. But soon she realized it's because of the advocacy you do for your patients. You don't do much medicine. You basically just administer medication and help with therapy, but that's about it. Most of the work you do is social, by making the patients feel more comfortable when they're at the hospital or nursing home, wherever you are. So nursing skills. Nurses typically have to be able to do the following things. They gotta be able to do vital signs like blood pressure, respirations, temperature, and pulse. They need to know how to start IVs to administer medication intravenously. They also need to learn how to administer a variety of different types of medications, shots, creams, pills, etc. As an oncology nurse, Stephanie works with a variety of individuals within the hospital. So her team normally includes, obviously, the patient, an oncologist, a oncology dietitian, an oncology social worker, and the patient's family. And if the patient has any other special needs that go beyond this, those people will be added to this team too, like hospice workers or physical therapy, and so on and so on. So, in conclusion, I learned a lot about how nursing was more advocacy. When you talk about nurses, you kind of just talk about when I grew up, whenever I used to say I wanted to be a nurse, I had a lot of people in my family be like, why not just go to medical school? You're gonna be like a doctor's slave, quote unquote. And I'm like, okay, like, whatever. But I learned through getting my CNA license that nurses do not do that at all. That's all CNAs. So, yeah, being a CNA, I watch a lot of advocacy go on throughout the nursing home, with nurses trying to tell the CNAs, no, do this, this is what they like. And so I really appreciate that. And then this was a quote by Van Gogh that I found that said, your profession is not what brings home your weekly paycheck. Your profession is what you're put here on earth to do, with such passion and such intensity that it becomes spiritual and calling. And I feel like this with nurses especially, I feel like this really, really would speak to a lot of them, because a lot of nurses, their work is hard. If you could make the same amount of money and not be yelled at every time you go to visit a patient's room, I'm pretty sure they'd find a job elsewhere. However, they stick to what they find is their calling on earth, and I feel like that's really important. And then that's it. Citations. Yep. Thank you.